Today's topic is azithromycin (AZT), which is known by the trade name Retrovir. It is an antiretroviral therapeutic agent used to treat HIV/AIDS. AZT works by selectively inhibiting HIV's reverse transcriptase and inhibiting the ability of the virus to infect a cell with its genetic material. In order to be effective, AZT must be first converted by host enzymes to AZT triphosphate, AZTTP. For this presentation, my job is to explain to the audience how AZT is turned into usable form. AZT is also known as azithromycin, the trade name Retrovir, which is often used to handle AIDS. AIDS stands for Acquired Immune Deficiency Syndrome, which compromises the immune system. This eventually causes microbes to cause harm to the person. Reverse transcriptase is an enzyme that catalyzes the formation of DNA from RNA. Reverse transcription takes place with an enzyme catalyzing it called reverse transcriptase. Reverse transcription takes place with an enzyme catalyzing it called reverse transcriptase, which is usually found in retroviruses. HIV is associated with infection of cells of the immune system, which include helper T cells. This binds to the surface receptors of the cell. Viral capsid is released into the host cell by the fusion of the membrane and viral envelope. Once it enters the cytoplasm of the cell, the enclosed capsid releases reverse transcriptase enzyme and viral RNA. Reverse transcriptase forms as dsDNA, double-strand DNA, using viral RNA as the template. The viral DNA enters into the nucleus and gets incorporated into the host DNA, forming a provirus. This provirus is transcribed into mRNA and translated into viral proteins by using the enzymes of the host. Viral particles are then assembled to form new viral particles. When the new viral particles separate from the host cell, viral envelope is formed by pinching off of the cell membrane. Azithromycin is a drug that is usually given to AIDS patients because it blocks the reverse transcriptase enzyme. This block of the enzyme would cause the prevention of the synthesis of DNA from the viral RNA. Patients that receive AZT as treatment have shown to have an increase in number of helper T cells, an increase in immunological activity, an increase in virostatic effect, increase in weight, and an increase in overall well-being as well. Also, good to note that AZT has specific side effects that include headache, nausea, and loss of appetite. The use of AZT on HIV patients can cause an increase in their CD4 plus cell counts, and also decrease the amount of HIV in their blood. It is good to note that neither of these are cures of HIV, just a form of treatment. AZT is often taken with a combination of other forms of anti-HIV drugs. Reverse transcriptase uses the host cell's nucleotides and makes DNA using HIV RNA as a template, and viral RNA is destroyed in this process. Reverse transcriptase and RNA are being assembled via host cells, and AZT and thymidine are very similar with each other, and reverse transcriptase often confuses the enzyme and is able to continue the process. When AZT is incorporated in the strand, it cannot be extended, and the HIV cycle is disrupted. AZT can be rejected by resistant HIV strands. Also good to note is that AZT is synthesized from a 11-2' deoxy 5-O-trityl beta D-lipoxyl thymine, which is treated with methanosulfonal chloride, and pyridine to make the corresponding mesylate, a 36-1 zidovudin, which is an analog of thymidine that inhibits replication of the AIDS virus.